Hello, this is Dr. Daniel Lopez-Tan. I'm the Medical Director for Legacy Hospice in Elm Grove, Wisconsin. I was asked to talk about end-of-life care. End-of-life is a difficult topic, as you know, because not only are we talking about losing a loved one, we're also talking about some difficult medical conditions, pain, distress, anxiety towards the end of life. These are difficult symptoms to manage, and it's difficult to watch for family members as well as the caregivers. Let's first talk about some of the medical considerations as far as how the body is shutting down and what symptoms arise from that, and then how do we manage those symptoms. So first, if we think about the heart is like our primary engine, right? It pumps the blood and provides nutrients to all the organ systems in our bodies. So the organ systems start to shut down before the heart actually ends. As you know, the end of life usually is signaled by the heart's last heartbeat, and when it stops, everything stops. So before that happens, the organs are actually starting to shut down, and there's a list of common symptoms that occur because of that. Those symptoms are usually shortness of breath, nausea, confusion, lethargy, pain. And so let's kind of go through some of those and think about what's happening in the body. The central nervous system, as it starts to shut down, you can experience confusion, cognitive decline, hallucinations. And then towards the end, as it gets worse, you can have more lethargy and unresponsiveness towards the end. And another example of the central nervous system shutting down is when it starts to stimulate the body to secrete stress hormones. These are catecholamines, or the sympathetic nervous system triggers the body to try to combat the dying process because it's sensing that body's getting into trouble. So it starts to secrete these stress hormones. But the problem is, because the body is dying, these hormones actually become more of a problem than a solution. And we can have a situation called terminal restlessness. This is when a patient experiences increased pain, anxiety, palpitations, and agitation due to these hormones. The gastrointestinal tract is another organ system that will show us how it's shutting down. First, you have decreased appetite, inability to take fluids, you may have swallowing problems. And towards the end, nausea and vomiting can also occur. And that's the signal that the body the intestines don't want to take any more nutrition. And it's in the process of shutting down. Another example would be the kidneys, which can stop making urine, and so you get fluid retention, and you can have edema, and also you are not able to expel your toxic metabolites in your body like you normally would. And these can also cause increased agitation and delirium and stress for the body. Pain usually is kind of a multi-system symptom, and can arise from different pain syndromes associated with cancers or even your arthritis as you become more immobile and unable to move. So there's a bunch of different sources for pain. That's why it's very common to see pain escalating towards the end as well. Fortunately, we have solutions in terms of medications that we can mitigate a lot of these symptoms towards the last few hours and the last few minutes of life. Morphine, or opioids, as a representative of the class of drugs, opioids, is commonly used in the end of life. And there's also benzodiazepines, which is an anti-anxiety drug like lorazepam or Xanax that we can use to mitigate some of the anxiety symptoms that occur in the last few hours and the last few minutes. So There has been a lot of concern about morphine being used to euthanize a patient or hasten death. And with a lot of hospice experience and through medical evaluations, this is really unfounded, especially in properly managed hospice patients towards the end of life. Using the appropriate dosing and using trained professionals that deal with end of life, morphine does not hasten that process. The patient is already dying of another condition, and the morphine simply is used, when used appropriately, it's used to mitigate the symptoms. Morphine is very effective for shortness of breath as well as pain management, and also reduces anxiety. We can also use other medications and other interventions to manage symptoms towards the end of life. But at the end of the day, we're there to try to reduce the symptoms in a patient that is terminal. We are not hastening that process, and if you use appropriate dosing and use the help of hospice professionals, this process can be a smooth transition rather than a very difficult one. So, in summary, I urge you to think about a few things. First, understand how the body's shutting down. As I explained, there are many reasons why we get symptoms that occur towards the end of life. And think about how to manage these with medications and the appropriate care. And also think about getting help from people that do the work for end of life, like hospice clinicians and physicians as well, and nurse practitioners. They can help with this process, and it will be a much better experience for the patient towards the end of life, especially in the last few minutes, in the last few hours of life. Thank you very much for listening. This is Dr. Daniel Lopez-Tan from Legacy Hospice in Elm Grove, Wisconsin.